This video will focus on the maternal health of the Ashanti tribe living in Ghana.
Ghana is located in West Africa and is a democratic nation of approximately 28 million people. The Ashanti region is located in the southern part of Ghana. The life expectancy is approximately 62 years of age.
The Ashanti people is the largest ethnic group in Ghana. Ashanti men are considered to be the authoritative leaders in the tribe and claim the role of breadwinner for the family, which is identical to the Homon culture. Women's roles revolve around homemaking and child raising.
Ghana is a middle to low income country, as 28% of its people live in poverty. As you can see, the gross national income is significantly low compared to other countries, like Canada. Ghana spends 2.1% of its gross domestic product on public health care.
Ghana's healthcare system is divided into two systems, public and private. The private system charges patients for services, while the public system relies on the national health insurance system.
The National Health Insurance Scheme costs $10 per year. This cost is a problem for many individuals as only 1/3 of the people can afford this insurance. This insurance system covers outpatient visits, hospitalizations, laboratory tests, and certain medications. Many rural Ghanaians rely on traditional healers because they are more easily accessible and affordable.
As of 2015, these are the top 8 Millennium Developmental Goals for Ghana. As shown, maternal health is incorporated in the top 5. From an ethic perspective, we see maternal health as a significant indicator of the health of a nation, and it needs to be treated as such. From an emic perspective, it is reported from the opinions of many women that they are frightened about getting pregnant due to the high rates of maternal death.
We will be focusing on 4 categories that impact maternal health. The social determinants of health will be incorporated in each of these categories.
In many areas, the lack of sanitation, poor drainage, and garbage systems contribute to an environment that is unhealthy for pregnant women. For example, there is a specific group of homeless female street carriers called Kayaye. These women are at a higher risk for poor maternal outcomes due to lack of social support and minimal access to insurance. These women are also at risk for developing infectious diseases like cholera, malaria, and STIs due to the environment.
Recently, Ghana stated that 319 maternal deaths occur in every 100,000 women. This is an extremely high number compared to other countries worldwide, just like Canada as seen below. The government set a Millennium Development Goal to decrease the maternal mortality rates by 75% in 2015. Unfortunately, they were unsuccessful. This was because there were no policies combating maternal death, contraception, and abortion are not socially accepted, and ambulances are extremely rare.
Maternal deaths occur more often in those who have a low level of education, those who live in rural areas, and those who are married. The most common causes of maternal mortality in Ghana are postpartum hemorrhage, infectious diseases, abortion, and non-infectious diseases.
Abortions are considered illegal in Ghana, and those who perform it are jailed. There are 3 exceptions to the abortion law: if pregnancy is due to rape or incest, risk the woman's life, or risk abnormalities to the child. Many healthcare professionals do not perform safe, legal abortions as they do not want to risk a criminal record. Many women sadly perform this act unsafely. It is estimated that 22 to 30% of maternal deaths are due to unsafe abortion. These women have been reported to insert objects, take high doses of the over-the-counter drugs, or douche with poisonous substances. These women use traditional healers to perform these abortions, who use herbs or physical beatings.
People that live in malaria-endemic regions, like Ghana, acquire some immunity to malaria, but this immunity diminishes during pregnancy. Malaria is a parasitic infection that is transmitted by mosquitoes. The microorganism that causes malaria creates infected red blood cells, and the body tries to naturally fight these off. The decrease in blood cells can lead to anemia and folic acid deficiencies, both of which are vital to fetal development. The second trimester has been noted to show the highest rate of infection. Thus, it is crucial to increase access to antepartum care in order to prevent malarial infection to the fetus.
Anemia is the most prevalent in Ghana because of the malaria endemic. Underdiagnosis and undertreatment of anemia leave women at increased risk for preventable causes of maternal death, including postpartum hemorrhage and preterm delivery. Risks for maternal anemia among the Ashanti women include young age, as many Ashanti women become pregnant young, malnutrition, specifically in vitamin B12 and folic acid, and infectious diseases like HIV or malaria.
Postpartum hemorrhages are the most common cause of maternal mortality in Ghana. Postpartum hemorrhage is referred to as excessive bleeding of greater than or equal to 500 mils vaginal delivery or greater to or equal than 1,000 mils cesarean. Postpartum hemorrhages in Ghana are highly related to the fact that only 53% of births are attended by a healthcare provider. The progress in preventing postpartum hemorrhages in Ghana is being delayed related to the fact that there is no national strategy to address postpartum hemorrhages prevention and management.
There are many traditional beliefs about pregnancy amongst Ghanaian women. Women who are unable to have children are considered witches and can cast spells on pregnant mothers, causing their family harm, abortions, or child malformations. Many pregnant women are hesitant to go into public and access health services in fear of witches. This is similar to the Hmong, who believe in traditional healing and supernatural beings such as the dab.
Maternal and child health is a good indicator of the healthcare system of a nation. Maternal health cannot be improved in isolation. It is part of a broader problem that can only be solved once the social determinants of health are addressed. By improving healthcare services, access to healthcare, living conditions, biological aspects, and supporting traditional health practices, Ghanaian women can begin to become empowered to improve their health status.